Good evening. It is a pleasure for us this evening to be able to share this meeting organized. And this is organized from Central America and Mexico together with the program Environment, Health, and from Central America and also from the North American, Latin American Hypertension Society. This is a very special webinar where we are going to be able to talk about a topic that is very interesting for all of us in our region. We would like to thank you for being here today, for taking your time to be part of this webinar and to be able to listen to the speakers. This is the agenda for today's event. So first, we would like to tell you that the agenda after we listen to every single member from the sponsor organizations, we are also going to be listening to Dr. Mariela de Los Angeles Campos, who is Secomixa Health Director, who is going to be talking about a strategy of prevention, mitigation, and control of CKDU and non-traditional CKDU in Central America and Dominican Republic 2022-2025. We are going to have a QA session. The QA session is going to be through the chat. If you have questions in English, we are going to be able to translate the questions into Spanish, but the presentations are going to be in Spanish. So once again, through the chat, we are going to be getting all the questions and translating them. So we are able to give answer to all the questions. Next, we would like to give you the option. Now we're gonna hear Dr. Marvin Gonzalez Quiros, who is from the SENCAM team from our consortium to start the presentation. Welcome, Dr. Marvin. Thank you so much, Professor Eldaura. Good evening and welcome all to this summit and webinar that we together organized with the Latin American Society of Hypertension and Renal Disease. And just remembering a little bit, SEMCAM Consortium started in 2012 after a meeting where we had different researchers from different countries around the world. We all have the same purpose, and it was to study the unknown chronic kidney disease, to understand the cause and how to prevent it. This was also having a mission to generate knowledge and to promote and facilitate the reduction of this disease that is acknowledged non-known disease in Mexico and Latin America as well. This consortium started with 53 scientists from 15 different countries. And the purpose of the consortium is to increase the international collaboration to explore and to research the investigation to reduce prevalence and as well to reduce impact and to work on the disease and making sure that this is an unknown disease in Mexico as well as Central America. That is why it's so important to have this webinar together with Cancomisca, where we are going to be talking about the new proposals and new strategies to prevent and to mitigate. And this is something that has been doing Comisca together with different health ministers to work against this disease. I also wanted to take advantage of this time to thank Dr. Dan Brooks for the help and the support getting interpretation for today from English, from Spanish to English. Welcome, Doctora, and thank you so much. Thank you, Dr. Marvin Gonzalez. Right now, we like to to Dr. Vicente Sanchez Polo, who is representing and is currently the president of Hypertension and Meteorology Organization, and he also is going to give us some welcoming words. Thank you, Professor Ildaura. I am the Islam Secretary, and on behalf of the organization as well as over Guillermo Alvarez president and over the co-workers and all the societies that we represent. We welcome you this evening and we would like to thank Dr. Maria de Los Angeles Campos, who is the director of Comprehensive Health Secretary from Latin America and Dominican Republic. Thank you so much for your time today. We all know that this chronic kidney disease in our continent is a very serious problem, and this is something that we need to know that there are some causes that are known, such as hypertension, diabetes, obesity, metabolic syndromes, among others. But we also have the non-traditional cause as one of the main reasons that are affecting populations in our country. So we know that the CKDU is a public health issue in a region and it's very complex because we have we have been facing this for a while and that is why we believe that together we're going to be stronger. And for Islam, it's a pleasure to be here this evening, being part of this webinar and also to share everything that we have in our hands or knowledge and everything else that is going to be helpful to study this disease, and also giving opportunity to the nephrologists in Central America and the Caribbean representing different organizations are going to be able to be part of this special fight, as I call it. We are very emotional. We are very excited to hear this initiative. And without anything else, I would like to thank Saltra Semkan Miska for getting all of us together. And this is such an amazing night. And I believe that it's important to acknowledge that we have four different organizations, well known organizations that are together to talk about different strategies, how to mitigate and to detect on time this disease that is affecting our population. So, welcome you all once again, and thanks for the opportunity. Thank you so much, Dr. Vicente Sanchez Polo. And now, as a regional coordinator from SALTA project, we would like to welcome Dr. Jennifer Crow. Thank you, Professor Ildaura. Welcome you all. I see a lot of familiar faces and also a lot of new members from SALTA team and from the environmental program, health and work programs. We are so happy to have you all here. Saltra started about 20 years ago under Dr. Wesson, among other members that had a vision to support and to help occupational health and environmental health in Latin America. Salsa, thanks to all these efforts, we do have at least one Saltra center. We also have one public university in every single Latin American country. And we always look to find interdisciplinary collaboration, international collaboration specifically in these topics that are very important for our population. And everything, of course, is related to environmental health and occupational health. And that is why for many years, Saltra has been working on this. And for all of us, this space represent these type of efforts and collaborations with international members and researchers. And we are very thankful to Comisca because, of course, they are donating this time so we are able to understand this amazing opportunity that we have with their strategy that they will gonna be presenting today. So thank you so much to all of you that are here today. Thank you, Dr. Jennifer. We would like to ask everyone to please try to keep your mics on mute to be working with us. And we know that there are some colleagues that are also trying to join the meeting. And once again, for all of us, it's a pleasure to be able to present Dr. Maria de los Angeles Campos. Sometimes I get confused with her name because I am so used to call her just Mariela, and many of us that know her well, we call her just Marie. And of course, we know that she has a very important title in our region, and she works with Central America and the Dominican Republic. She is a pharmaceutical chemist. She has a master. Currently, she's doing a PhD and public managed and organization development. She has a specialization in international health approved with distinction by the PAHO and WHO and ethics of research in human subjects and intellectual property rights and public health. She